this one here.
Okay. So which of the following interventions is most likely to improve this patient's liver function? So a 55-year-old man with a history of type 2 diabetes and obesity presents to his PCP for routine checkup. Liver function tests reveal elevated ALT and AST. He denies any history of alcohol consumption. Ultrasound of the liver shows diffuse hyperechogenicity. Okay. So right off the bat, I don't really remember too much what hyperechogenicity means, but just going through the answer choices. Okay, so family med perspective, you don't want to refer them for liver transplantation.
Okay.
Um, I mean, just by the wording of it, weight loss and lifestyle modification, but that might look good, but does that go with liver? Um, okay, let's see. So what's going on here? It just says he has elevated ALT and AST. Yeah, so let's go with the most conservative. And then I think their line of thought is if that doesn't work, then you'll, prescribe a statin or whatever you need to. So
Yeah, so let's talk to you about good. So this is very family med, kind of train of thought that you're going through. Diagnosis wise, this is called fatty liver disease, is what this patient
oh,
has. Fatty liver disease is contributed by what? Diabetes, obesity, but mainly, the more BMI you have, the higher chance you have fatty liver. So how do you fight fatty liver? Well, if it's fatty, then lose weight, right? Losing weight will help that a lot with fatty liver disease or non-alcoholic fatty liver disease, right? So giving medications up front, that's not, that's really not going to help as much, right? But like you said, statin can be in the future, but really, if you want to help him overall, meaning his diabetes, his obesity, and his non-alcoholic fatty liver, then weight loss and lifestyle modifications. But do you see kind of that perspective? It makes the question kind of easy.
yeah. Do you know, um, like how do you know this is fatty liver? Is it the hyperechogenicity?
Yeah, so anytime you see like it, that it's non-alcoholic fatty liver disease because you have elevated, liver enzymes, so the liver is damaged at some point, and then you have this, diffusely hyperechogenicity, meaning that all over the liver you have these weird densities that are not supposed to be there, and that just says that it's fatty liver.
Yeah, and I guess also denies alcohol, so it's not that.
Yep. And like I said, they give you some risk factors at the beginning, right? Type 2 diabetes and obesity.
Okay.